Hi, thanks for rejoining me. I'm going to start with a little bit of an educational as to why we feel the way in which we do when our progesterone takes a decline. The feelings of complete overwhelm, the anxiety, global anxiety, where we worry about everything. We might not want to leave the house. We tend to lose our confidence. We don't remember things. We have brain fog and a lack of word retrieval. And that is caused by the hormone progesterone, which means to progestate, to promote a pregnancy. It falls away and it leaves us with the more mental and emotional symptoms of menopause. And every single month when we're menstruating, that luteal phase of day 21 to 28 is where progesterone wasn't present. It would fall away to allow us to menstruate, and we may well have suffered from similar feelings through PMS. It's often termed as PMT, and that was why. It's because our progesterone was no longer present, but it's just that we weren't taught this. We also see a lot of doctors prescribing antidepressants for the treatment of menopause, and there really is no need. Many doctors don't have more than 2 hours formal menopause training when it comes to menopause. And at the age of 45, I'm now 52, but at the age of 45, I hit a time where I didn't sleep. I had brain fog, anxiety, depression. I couldn't remember what I was due to be doing. I went to the GP and I was offered antidepressants, and I knew it wasn't the way forward, but I decided to step away from my job because I wondered whether the pressures of work — I was lecturing at that time within colleges and universities — whether it was the pressure of work that was causing me to feel the way in which I did. I felt written off as a woman, and that a younger woman should be doing my job role. And the more I read, the more I learnt that statistics showed that 1 in 3 women step away from the workplace during their menopause. And yet menopausal women are knowledgeable, and we should be staying within our job role. We shouldn't feel that we're that compromised that we need to step away from it. I was lucky. I met a neighbour of mine. She was Canadian and had been treated in Canada for hormone decline. She'd had her hormones rebalanced to an optimum level, and she felt well every day. And it was Angela that told me that I was going through a time whereby my estrogen was dominant, and that's why I couldn't lose any weight, and my progesterone was much lower than my estrogen, and that's why I was filled with dread and global anxiety, and I worried about absolutely everything. And she told me about a clinic in London whereby I could have my hormones addressed and brought back to an optimum level of health so that I'd feel well every day. Now, travelling to London was something at the time that filled me with dread. When I tell you that getting into my vehicle and driving to the local supermarket was hard enough due to the anxiety I was going through, getting on that train and going down to London took all my ability and all of my strength and determination. But I was determined to find a solution to feeling written off. And so I got on that train and tube, and I arrived at the clinic to be met by a lovely physician who told me that, ever lightly, because my progesterone was in my boots and my estrogen was dominant, that I wouldn't have been able to lose my weight, and I would have been feeling like this, and it was perfectly normal, but that it could be addressed. And so she took my blood and it was sent away for diagnostic testing. And I can remember travelling home in tears because somebody knew what I was going through, and I didn't have to hide my feelings anymore or feel ashamed that I couldn't function, because I wasn't clinically depressed as I thought, but I was going through a time of hormone decline which was causing me to feel the way in which I did. A few days later, I had a call from that very same doctor who informed me that my estrogen and progesterone and testosterone had taken a change, a decline, and so she was going to provide me with bioidentical hormone rebalance to bring those hormones back up to an optimum level of health. And they came through the post to me, a Versa-based cream that I rubbed into my wrist on a daily basis, and it went into my bloodstream. By day 4, the brain fog had lifted. I could retrieve my words, I could remember things, and I didn't feel as depressed. My black and white life, if you like, started to come back in the brightest of colours, and I didn't feel so poorly anymore. I was able to face my world, and my hot flushes stopped within 3 weeks after that. And so I knew that with the estrogen, the progesterone, and the testosterone that she'd given me, that I would start to flourish and feel much better as promised. And it worked so well for me that I decided to bring together physicians, menopause specialists that would be able to support women from the comfort of their own home. Because here's the thing, I was so full of overwhelm when it came to that journey down to London that I thought there has to be a better way for women out there. And so 3 years ago, I launched Equilibrium Clinic, and since then we've seen many hundreds of patients who were struggling exactly the same as I was. And if it is you don't want to travel, you can have that consultation with that specialist menopause consultant from the comfort of your own home. We can even send out blood diagnostic testing by way of a finger prick for you to be able to determine exactly where your hormones lie, and from there again medication can be sent direct to your door. I've included a free 15-minute phone consultation alongside this educational. If it is you'd like to know more or discuss your individual needs before you speak to a specialist menopause doctor, then just fill it out the symptom checker below and see where your hormones are, and hopefully you can start to feel well again if it is you choose to embark on a journey of either bioidentical hormone rebalance, which is private. You may still want to go through the NHS but want the advice of a specialist menopause consultant to be guided by what is available in terms of body identical hormones through the NHS. That's available too. So thanks so much for listening, and I hope very much to be seeing your questionnaires coming through so that we can help you address your symptoms. Take care.